Today we're talking about treating sleep apnea without CPAP with sleep physician Dr. Audrey Wells. She's a board-certified sleep medicine physician and the founder of Super Sleep MD. And if you're a clinician who wants to uplevel your sleep medicine knowledge, go ahead and subscribe to this channel, enjoy the community, and keep learning about sleep and mental health. I'm Dr. Nishi Gopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and every video is eligible for CME credits. And before we jump in, I'd like to invite you to get my free sleep mini course for outpatient doctors. It's filled with lots of tips to use in your clinical practice. So you can grab that at intrabalance.com/doctors. So today I'm joined by Dr. Wells. She's a sleep medicine physician and a certified mindset coach who's on a mission to help people sleep better so they can feel more awake and alive all day long. She's the founder of Super Sleep MD, a platform that offers a group coaching program and a private Facebook community for those struggling with sleep apnea and its treatment, including CPAP and CPAP alternatives, which we're talking about today. She also does individual coaching for those who want to uplevel their productivity and potential by taking too tired out of the equation. So, and if this type of information is helpful for you, go ahead and click the like button because that's going to help feed the YouTube algorithm and get this information out to more people. All right, well, Dr. Wells, I'm really excited to talk to you today about CPAP alternatives because one of the things that I hear all the time from patients, especially when I talk to them about getting tested or treated for sleep apnea, is I don't want to wear that Darth Vader mask. Yeah. And CPAP is the gold standard treatment, which we'll talk about in a moment, but there are lots of other things that we can do as well. So let's start by talking a little bit about CPAP and why that is the first line treatment that we recommend.
You're right about patients thinking that a sleep evaluation is going to end in what I affectionately call the PAP slap. So you get the mask because it's the gold standard for treatment. And the reason is because it addresses the multi-level obstruction that is the potential with sleep apnea. So a lot of people associate sleep disordered breathing and sleep apnea with a tongue problem. The tongue falls back in the throat because of the relaxation during sleep. But in actuality, most of the time, the obstruction is anywhere from sort of the back of the nose all the way down to the back of the throat, where just below where the tongue inserts. So the CPAP air acts as a stent on all those levels to give that airway more openness, more patency for breathing in and breathing out normally throughout the night. And we know that it's 95% plus effective when it's applied and titrated to the right amount to hold open the airway. The problem is it's only effective when it's used, and that's a big stumbling block for a lot of folks who are prescribed CPAP.
CPAP is the gold standard treatment, or PAP therapy, which is positive airway pressure. And there's different kinds of PAP therapy. CPAP is one kind. But yeah, I often hear from patients as well that I'm not going to be able to sleep with that thing on my face. How can I can't sleep on my side, or I want to wear my glasses and read in bed. So there are some ways to optimize PAP therapy. So I'd love to hear a little bit more about that before we go into alternatives to PAP.
Definitely. I think that the preconceived notions that people bring into a visit have a lot to do with their long-term success. So I try to bring people back to kind of a beginner's mindset, right? They're starting something new and kind of taking the time to go slowly, learn about it, and kind of incorporate it into your routine goes a long way to helping people and their comfort. The biggest issue with CPAP and CPAP comfort is typically the mask. And it's the most intimate part of CPAP therapy because it's the part that touches you. And I think it's interesting that when people talk about it, there's this hand motion. Do you see that a lot too?
Yes.
And that really is sort of a nod to the full face mask that covers the nose and the mouth. And, for people who absolutely can't breathe through their nose, I think that's a good first choice. But the truth is that people who use nasal masks, whether it goes over the nose or fits inside the nostrils or comes up to the nostrils, nasal mask or nasal CPAP, it is shown to have more comfort and a higher compliance rate compared to full face mask usage. So generally, I talk to people about just being prepared for trial and error. I know you use the example of shoes. It's like trying a different pair of shoes. I'm a little bit partial to women, and so I like to say it's like choosing a bra. The very first bra you choose is not going to be the best bra for you. And you got to kind of go through that trial and error process to work out, how do you adjust the straps and how much coverage do you want? And how comfortable is it going to be to wear for hours at a time? And I think that helps to reframe expectations a little bit and just get people into the idea that there's going to be a little trial and error here, and that's normal.
Absolutely. So I think that's really important. Just, like you said, having that beginner's mind and having the right mindset going into it, because that really will shape a person's experience. So for clinicians who are listening, hopefully you can take away some of these points to share with your patients as you navigate these conversations, because it's not just sleep doctors who are talking about sleep apnea. It's primary care physicians, it's psychiatrists, it's physicians of all specialties. So, so hopefully you can take some of these points away to help support your patients. So let's talk a little bit about alternatives to CPAP. And then, if there are other areas we want to talk about with regard to CPAP, we can look at those as well. But what are the alternatives? I know a lot of clinicians have heard about the oral appliance or the dental device, which we'll talk about, but there's other things too. So could you shed some light on some of these alternatives?
For sure. And I'm so glad to have some space to talk about this, because I think a lot of times when people perceive that CPAP is the only treatment, it prevents them from getting evaluated at all because they think there's no other choice. But in order to empower patients and also empower the people who talk to them about their sleep, I wanted to let them know that there's other things besides CPAP that are available. And it's not necessarily the case that you would have an either or situation. You can pursue two treatments simultaneously if that works for you, or alternate treatments as you see fit. So it opens up sort of a myriad of possibilities. And I created an online course to describe 21 plus CPAP alternatives. Now, within the course, there are about 10 treatments that are featured, and half of them are non-surgical treatments, and the other half are surgical treatments. And that's sort of the first division point for people who are considering CPAP alternatives is, do I want a surgery or do I want something that's not invasive?
Great. I'm sorry. I was just going to say, we'll link to that course. So the 21 plus CPAP alternatives, we'll put the link on the screen there and in the video description, because I think that's a great resource, both for patients and for clinicians who want to learn more.
Yeah, I hope it is, because I think that sometimes the conversation just needs to be going on a little longer and having more choices. So this is one way to get that. And for medical providers, there is continuing medical education credits associated with the course in case that's an incentive. For non-surgical treatments, really the sort of shining light is the oral appliance treatment. And currently there's more than 100 different oral appliances on the market. So it's really a lot of things out there. I happen to have one today. This is by a company called Somnomad. And all of these work in about the same way. So you can see that there is a custom-made piece that fits on the upper and lower teeth. And this customization is really important for a couple of reasons. One is that it is made for each individual and supports the tooth structure, and the tooth structure supports the oral appliance. So it holds your jaw forward. There's a little spring mechanism on the side here that pulls the lower jaw forward to sort of open up the airway caliber. The other reason that the customization is important is because it makes the appliance less bulky compared to one that you would buy over the counter that's boil and bite. And that's critical because the tongue needs to be able to fit within the oral cavity and not compete with the material of the oral appliance. If the oral appliance takes up too much space, your tongue is further back in your mouth, and that just creates more problems.
Excellent. And so is that covered by insurance?
A lot of times it is. And people ask me about Medicare quite a bit. Medicare does cover oral appliances. Typically, it's the Thornton anterior positioner device or TAP device that they cover, but there are many other types of devices available. These are made by dentists trained in sleep dental medicine. And so they're experienced in not only constructing the devices, but also adjusting them after they're made. And oftentimes they can do a lot to help with reimbursement or with establishing insurance coverage upfront.
Great. That's very helpful. And who would you say would be a good candidate for an oral appliance?
This is a really interesting question. I think it's evolving with every passing year. So initially, oral appliances were really recommended for people who had mild sleep apnea. Then it started to bleed into some success with moderate sleep apnea. And now there are people who have severe sleep apnea who respond to the oral appliance. Now, the big thing that I want folks to know is that when you have an oral appliance made and you are acclimating to it, and there is an acclimation period, just like with CPAP, it's very important to check sleep for sleep apnea after you are used to it. The reason is it may not be working for you, and you can't know until after you have that follow-up test. I've had, unfortunately, a number of people come back with sleep apnea that's the same as when they started, or it's not entirely effective, so they still have daytime effects with sleepiness and memory problems and mood issues. So unfortunately, you still do have to check afterwards to confirm that it's working.
So that's a great reminder for people, especially clinicians, if you're sending your patients out for treatment with an oral appliance, that there's a process. It has to be custom made for them. It has to be calibrated. And then it needs to be tested afterwards. So let's go beyond the oral appliance and talk about some other alternatives. What else do you have for us today?
Also in the non-surgical category is weight loss. People ask me about weight loss as a treatment for their sleep apnea. And I think there's a lot of appeal to that because it sort of has the getting down to the root cause appeal. So it's a myth that everyone who has sleep apnea has a weight issue. That is not true. About 20% of people who have sleep apnea don't have overweight or obesity. And so, for those folks, weight loss or weight reduction is not going to be that helpful because they're simply not at a starting point that's going to make much of a difference. However, for people who want to lose weight anyway or see that as a potential treatment for their sleep apnea, it's something that I review in the course because it is entirely possible. Also in the course are the 9 different root causes of sleep apnea, some of the more unknown things. And if your watchers are interested, I can actually give you a PDF copy of the 9 different causes of sleep apnea. Weight is definitely on there, but I'd like people to know that it's not just a weight problem. So weight loss may not correct the issue.
Great. Well, thank you for that. And we'll put the link to that PDF, the 9 root causes of sleep apnea, in the video description as well. So that's a really good reminder too, that you just provided, which is that sometimes sleep apnea can be weight related, sometimes not. Not everyone who has sleep apnea, has it's not always related to weight. And I've also seen patients where just a little bit of weight loss can help alleviate their symptoms. So we're not necessarily talking about, a 30-pound weight loss that's required to improve the symptoms of sleep apnea. Sometimes it's just a few pounds that can make a difference.
Yes. And oftentimes folks will say to me, it wasn't until I gained these last 10 or 15 pounds when I started having trouble. And if that's in recent memory, that's a good prognostic indicator that you may be able to pull back from having sleep apnea if you can lose those pounds. The interesting thing, though, is that untreated or undertreated sleep apnea is a risk factor for weight gain. So I don't have a lot of success stories for people who decided to use that as their first line approach. I think it's better to get your sleep apnea treated and work on weight concomitantly, and then see after you lost weight, how did it affect your sleep apnea?
Yes, exactly. And that's my recommendation as well to people is get the sleep apnea treated, and it's going to make it easier for you to lose the weight. Because when we have sleep apnea, it puts the body into a stress state, and it's more likely to hold on to the weight and harder to lose. And then losing the weight can help alleviate symptoms, and they may not need treatment anymore. So that's an excellent reminder. What are some other non-surgical treatments you might recommend?
There are some new therapies coming out, and I can show you, if we stop, I can get another little treatment that's kind of fun to look at. Hold on a second. You've probably seen the Excite OSA.
No, I haven't actually seen it.
So one thing I can demo for you is this device here, which is called Excite OSA. And this is something that you use during the day. It's not anything at night, and I think that that makes it a very attractive treatment. At this time, it's approved for mild and maybe moderate sleep apnea. I know there's ongoing research with this. But the way it works is you put this in your mouth, and your tongue sort of fills up the space below. And there's two electrodes here that send a pulse into the tongue muscle. And over about 20 minutes, this will run an automatic program as you're holding it in your mouth. And the idea is to change the muscular structure of the tongue to get it more toned, so to speak. Now, one of the things that I talk about is whenever you're thinking about how to best treat sleep apnea, you never want to forget about your REM sleep. That's so critical. And the jury is still out on whether a device like this would be effective during REM sleep. And that's especially important for women who have worsening of their sleep apnea during REM sleep, or for anyone who has very dramatic drops in their blood oxygen because of that low muscle tone during REM. So even if the tongue is toned, it still may be floppy enough to cause problems. So that was the Excite OSA.
All right. Well, that's an exciting one to see. And so with that one, same questions. Is it covered by insurance? And then who might be a good candidate for that sort of device?
It is not currently covered by insurance. The cost is a little bit more than $1,500. And the company is mitigating this, that steep cost by saying there's 100% money back guarantee if it doesn't help you. There is a fairly significant time commitment in that you have this regular pulse regimen that you run through daily for 6 weeks, and you dial it up as much as you can tolerate. So it is a little bit shocky. It reminds me of having a rubber band around your wrist and kind of popping it. That's the kind of sensation. And then after that, you have maintenance. So some people use it twice a week or 3 times a week in order to maintain that muscular structure for the tongue. So it's not as if you do it for 6 weeks and then you're done forever. You still have to keep that maintenance going. And that also includes replacing this piece every 90 days. The device will not work if you try to use it longer. So this should be replaced for sanitary reasons and also so it's working optimally.
Okay, excellent.
And just as far as who it's good for, I think people who are willing to do that, who can be sort of on top of that protocol, mild sleep apnea. And I think if I were advising my family member, I would not want to see that worsening in REM sleep. I would want to make sure that it was really a position thing or just sort of a homogeneous type of sleep apnea that occurs throughout the night.
Okay, great. Yep, that's really helpful. And so you mentioned position. So what about positional therapy? How does that fit in?
that is also one of the treatments for in the non-surgical arm. Now, position therapy comes in kind of two different flavors. You have the electronic sleep positioners, and then you have the ones that are just sort of physical positioners. So some examples of that are the Z-Zoma, the Remedy. In the past, I think it was kind of common advice to tell people sew a tennis ball in the back of your t-shirt, but truly that doesn't seem to work too well because you can overcome it. And especially if you have a mattress topper, you can't really feel that. So the physical sleep positioners usually have a neoprene belt that's worn across the chest. And then on the back, there's a wedged or a blow up sort of thing that sort of sticks out further from your back, and it really prevents you from rolling onto the back. Now, this would be a good treatment for somebody who has sleep apnea only when they're sleeping on the back. And this is one reason why it's important to capture some of that sleep on the back when you do a sleep test, because then you know. So I like to see sleep both on the side and on the back. There are some sort of electrically charged position devices as well. Philips has one called the IntraBalance, and that's also worn around the midsection. You recharge it so that it's ready to go when you're ready to sleep. And the way that it works is through vibration. So if it detects that you're sleeping on your back, it will vibrate, hopefully enough to wake you up, and then move to the side. And that sort of takes the place of the wife's elbow in the side. So maybe the wife sleeps better too.
Great. That's really interesting. And it's just interesting to hear all the new developments in the sleep medicine world. Many of these things weren't around when at least when I was doing my sleep medicine fellowship. A number of years ago. Yeah. Are there any other non-surgical treatments to discuss, or should we talk about surgical interventions?
I'm a little bit excited to talk about surgical interventions. I also have a couple of things to show. I think the primary one that people have heard about is the Inspire device. So this is also known as a hypoglossal nerve stimulator, and there are a couple of Inspire competitors coming out soon. So it'll be interesting to see how the landscape changes with that. But the Inspire device has been advertised pretty heavily, and so I think a lot of people have some familiarity with what it is. I want to show you both the remote and the controller. So this is the implanted piece, and it's gone through a couple of revisions. As far as I know, I have the latest one. You can see it has some thickness to it, and it's, I don't know if I have, here's a chapstick I can show you for size comparison. Now, this is planted in the upper right chest, and it's just sort of under the collarbone. You can see it. If you don't have a lot of tissue under your skin, you can definitely feel it as well. They put it on the right side because they want to leave the left side open for pacemaker. And nowadays, there's 2 incisions for the Inspire transplant. One is going to be a 2-inch incision to place this, and then the other one is a 2-inch incision under your chin, sort of on the neck. And they try to put that in a fold so that the scar is not very visible. This device has 2 electrodes coming out. One goes to an intercostal rib, and that helps to measure the breathing rate. So the device knows when the person is taking a breath. The other electrode is snaked up into the base of the tongue where the hypoglossal nerve sits. And that's the tongue, that's the nerve that innervates the tongue. And it coordinates with your breathing to push the tongue forward into a position where it's out of the airway with every breath. So you turn on your device with this soft remote at night. It's sort of something you just put over your chest. It activates the device when you're ready to sleep. And then as you breathe, your tongue is scrunching forward to pull your that muscle out of the airway. This gets a lot of questions because it sounds really sexy and, it's a surgery. And I think there's appeal for surgery. I remember a friend of mine once told me, he was an ENT surgeon, and as far as I know, he still is. He said, even if a surgery is only partially successful, it's with you every night. And so I think, for people who are looking for a CPAP alternative that's lower maintenance, having that assurance that at the very least, you're going to be partially treated with a device like Inspire is reassuring. The thing that doesn't come through in the marketing is the runway leading up to the surgery and also what happens afterward. So I go into this in some detail with the course because I want people to understand how their insurance plays a role in this. So everybody's deductible renews at the end of a year. And so timing plays a little bit of a part. And there's also some evaluation that you need before you're even considered a candidate for the device. Okay. So for example, if you are doing quite well on your CPAP, you're using it nightly and it's been shown to correct your sleep apnea, you're actually not a candidate at this time. And it's not the case that you can go into the sleep doc and say, I just don't like it anymore. So sign me up for the Inspire thing. So you have to be intolerant of CPAP. You have to have central sleep apneas less than a quarter of your total AHI score. And your AHI score, which is the number of airway obstructions per hour of sleep time, has to be between 15 and 65. No more and no less. There are criteria for BMI. So that's probably changing. Some insurances require a BMI of 32 or less. That's body mass index. Some will allow you to go up to 35. There's also a procedure called a DICE exam. It's a sedated endoscopy where the pattern of your airway collapse is assessed. And it's very important because that predicts how well you might do with the Inspire. So on the sedated endoscopy, you're going to look for forward to back collapse, not concentric collapse, because if your airway is collapsing concentrically, you're just getting too much obstruction from those lateral walls, and this is not likely to help. Final point is that you have to have a sleep evaluation with a sleep study within 2 years of being considered for Inspire candidacy. And so a lot of people find that to be an obstacle because it's months to get into the sleep doc and it's months to get tested. And, it really ends up taking quite a while.
Yeah, that's a really interesting option for people, though. Because as we were discussing at the beginning of this conversation, the mask and PAP devices aren't appealing to everybody, and this is something that you can easily travel with, and it's with you all the time, as you said. I'm curious, what's your experience with this device in your patient population? What sort of results have you seen?
Well, the Inspire device originated here in Minnesota. And even before that, I was seeing folks in New Mexico who had gone through the surgery. I've also sort of taken informal polls of colleagues with patients who went through the Inspire process. I can tell you that at least for me, the success rate is not as high as what's reported on the website. And a lot of folks are disappointed to know that snoring doesn't always go away. Sometimes that's especially important for the bed partner. And there's also, acclimation to the tongue scrunching feeling. And so for people who have insomnia, in addition to sleep apnea, oftentimes it aggravates the problem. And it's really frustrating because I think there's so much hope that their sleep problems would be resolved. And unfortunately, that's something that can lead to the device taken out because it's just not a good fit.
Right. Okay. That's really interesting.
All that being said, I just want to say it is a very good option for people. There's certainly folks out there who are very satisfied and evangelists for the surgery. Right. So I think that this is just another personal choice that has to be made. And I'm so happy that there are choices with sleep apnea.
Yes, absolutely. And again, for clinicians who are listening or patients who are listening, you have options. And so don't be afraid to have a conversation with your sleep specialist about the different options that are available. And if you're not being offered these different options, maybe get a second opinion and see if some of these might be right for you. Okay, so what else do we have in the surgical category?
I want to show you what's something that's called the airlift. I have a little demonstration here. So the airlift procedure has been around, I think, since around 2009, 2010. So this is nothing new, but this is something that it's a it's a hyoid bone advancement. So in this model, here's the hyoid bone in white, and then we have the lower jaw with the teeth. I know the black isn't showing up great, but this is the lower jaw. Here's the chin. And then the hyoid bone is the only bone in the body that's sort of suspended. It's not articulating with another bone. And you can kind of feel it in your throat here. So it sits for me right about here. And this is a procedure that addresses airway obstruction that's happening below the level of the tongue base, which is not entirely uncommon. So if a person has collapse in that area, the airlift procedure involves putting 2 screws in on the underside of the bone here. And then there is a threaded loop tool that sort of places these sutures, which are very strong and very inert, around the hyoid bone. And then that bone is brought up with some tension on it, and the screws are tightened around the strings so that bone is suspended in a forward position. And just like the oral appliance, the idea is to pull those tissues forward and out of the airway so they're not so causing collapse. Here's a pro tip. Sometimes when a person has sleep apnea, especially if it's in the severe range, there needs to be multiple surgical procedures, and they can be done in succession or they can be done all at once. So depending on how a person is collapsing, you might elect to do the airlift procedure in combination with the Inspire. Alternatively, if you are not qualified for Inspire because your AHI is 80, let's say, you could see on the sedated endoscopy if hyoid suspension with the airlift might be a choice. You can get that, see if your AHI comes down into the range of getting the Inspire procedure. So these are a little, just some mental flexibility exercises meant to show people that combination treatment is an alternative as well. And you can mix and match a lot of things. You can do CPAP with an oral appliance. You can do different surgeries. You can do a nasal procedure with a turbinectomy to open up and breathe through the nose. You can do myofascial exercises to get that good tongue posture up in the roof of your mouth. All of these things are choices that not only would help you sleep better, but also breathe better through your nose and such. So that's something I highlight in the course as well, how to get creative with your sleep apnea treatment.
Excellent. That's so helpful and just so interesting. Thank you for showing us all of these different devices and the models. Because yes, as you said, we can be creative with treatment. And we haven't even talked about lifestyle measures and things like that. It's a little bit beyond the scope of this discussion today, but there's no one quick fix. Right. And can tailor treatments according to a person's individual needs. Are there any other interventions non-CPAP interventions that you'd like to share? I
think that it's worthwhile to kind of look ahead at medications for sleep apnea. Those are not really terribly effective at this point, but I think there's a lot of interest in developing medications that help with not only like tongue posturing, but also the neurorespiratory control of breathing, which is something that we have a long way to go in terms of our understanding. However, that is one of the root causes of sleep apnea and therefore a potential therapeutic target. So I think right now medications aren't great, at least for obstructive sleep apnea, but it's something to look at in the future.
Excellent. Yeah, no, it's really interesting to see the developments in this area. And we've been talking mostly about obstructive sleep apnea, and there's a lot of interesting treatments happening in the realm of central sleep apnea as well. And combination therapy can be quite effective for people who have central or complex sleep apnea. So maybe we'll save that discussion for another time. Could you tell us a little bit more about your course, 21 plus CPAP alternatives, and what can people expect in the course?
Sure. So I created this course because it's way too much to kind of tell a person in a 20-minute visit what their options might be. And one of the points that I make is that I'm agnostic when it comes to sleep apnea treatments. So I have no relationship with Inspire other than having seen patients with this. I have no connection with oral appliances or whatever. I am simply breaking down my clinical experience and knowledge for people to consume so that they can go into an appointment informed and kind of having a better idea of what they might want. So I think it's really important to figure out what's going to fit your lifestyle. I mentioned that I've divided the course into surgical and non-surgical treatments. And then within those, I have several featured treatments where I really drill down what to expect in terms of timeline, insurance coverage, and I have a fun little category I like to call the family test, which is, would I recommend this treatment to a family member of mine, or would I do it myself? And I think that helps to put in perspective what somebody might take as my own personal opinion, because you always want to do the very best you can. The courses have videos, their videos are maybe 10 to 20 minutes long, and there's a worksheet that comes with it to sort of capture all this information so it's easy to go back to or refer to if you're sitting in your doctor's office. And I mentioned the CME that's available in case people want to take that and get it paid for or get credit for the learning. It's available on my website, which is supersleepmd.com. It's called 21 Plus CPAP Alternatives. I have counted them all up. There are more than 21, but I like that little number. So it's available, and I'd certainly encourage people to take it if this is an interest to them.
Excellent. No, I think that's a great resource. And I haven't really seen anything out there that compiles all of these different options and really explains them in a systematic way. So I think that's a wonderful resource for people to be able to access. And again, we'll put the link to it on the screen and then in the video description as well. And we'll also link to the 9 root causes of sleep apnea handout that you've generously shared with us today. So if people want to work with you or they want to learn more about your courses or other offerings, where can they find out more?
Super Sleep MD has a lot of information. I have a free membership where there's resources for CPAP users. I also host a Facebook group for people who are seeking out sleep apnea treatment and trying to optimize that, no matter how it looks, CPAP or otherwise. I do group coaching sessions where I take people sort of in a more hands-on way through the different course materials. And then I also do one-on-one consulting to take a deep dive into sleep issues, not just sleep apnea, but also insomnia or shift work. So I can help people to customize their sleep in a way that works better for them. Excellent.
Okay. Well, thank you, Dr. Wells, for sharing your wealth of knowledge with us today. We've just kind of scratched the surface on sleep apnea and sleep apnea treatment. So I really appreciate you taking the time to do this.
It's my pleasure.
If you're a clinician who wants to uplevel your sleep medicine knowledge, go ahead and subscribe to this channel, enjoy the community, and keep learning about sleep and mental health. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine, and every video is eligible for CME credits.